Hello, everyone. This is Adam with psychedelicinvest.com. I hope you guys are all having a wonderful, wonderful week. In today's episode, we're going to have a weekly extractions where I basically pick some of the highlights coming out of the psychedelic sector this week and I give my perspective on them. The focus of this week's episode is going to be atai and the pipeline highlights that we've recently seen come out of their camp. So without further ado, let's get this started. All right, leading things off here, we have atai Life Sciences announces positive initial results for phase 1 trial of KUR-101, an oral formulation of mitragynine for OUD, opiate use disorder. So, what is mitragynine and what is special about KUR-101? So, KUR-101 is a deuterated form of mitragynine. So, I think to oversimplify things, the most important thing to know about deuteration is that it will increase the half-life of whatever molecule is deuterated. So, for something that is going to be targeted for opiate use disorder, like mitragynine. So mitragynine is the active ingredient in kratom. Many within the psychedelic community and many generally have been exposed to kratom at this point. So many people use it for pain management. They use it to taper themselves off of opiates after a prolonged use of opiates or after opiate addiction. It's very effective. Now, what makes kratom so effective? Number one is it is obviously a painkiller. It's an opiate. So for those who are looking for that opiate-like result or effect, it will provide that. But it has a much, much higher profile than typical painkillers that we're used to, Oxycontin and the such. So why does it have a higher safety profile? So basically, mitragynine, aka kratom, doesn't cause respiratory depression. So when people overdose on opiates or when you're in an overdose, what happens is you get respiratory depression, and that's what leads to death or the complications with overdose usually. So mitragynine, aka kratom, has a much higher safety profile. So that is, in general, if we're going to look at it from just that basic perspective, it's head and shoulders more better. It's head and shoulders better than the traditional opiates we have on the market. People have been using kratom for many, 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 many years at this point. People buy the leaves, they buy the ground up, the concentrates. They just buy it in pill form. It's available. You can buy it. It's just not really regulated by the FDA currently. Now, in general, what people should be aware of when buying kratom, street kratom or just kratom online, is that it can leach heavy metals out of the soil that it's being grown in. So this is where I'm going to formulate my opinion in terms of the advantage of having an FDA approved formulation of mitragynine on the market. So anyway, here are the results, or the important things to note from what atai Life Sciences says about this. So the initial results showed that a single ascending oral dosage of KUR-101, that's mitragynine, produces dose-dependent pain relief with effects on respiration comparable to that of a placebo. So I think that's the important part here. So on an ascending oral dosage, it had comparable effects of that of placebo, meaning that compared to a placebo, the respiratory effects were basically the same thing. So that's exactly what you want to see for something like mitragynine that's being pushed through the FDA pipeline as touted as an opiate with a higher safety profile. I'm not sure that atai is actually touting it as an opiate with a higher safety profile, but that's exactly what it is. So now here's one other thing I want to bring to the table here. So the indication here is for OUD, for opiate use disorder, but they're going to be able to prescribe mitragynine, kratom, for pain management as well. It's used for pain management currently very, very, very frequently. I think most of the time people are using kratom for pain management or mitragynine for pain management. So the addressable market here is gigantic, and this is, in my opinion, one of the most significant formulations in atai's war chest, and I think it's being severely overlooked. So yeah, I'm very optimistic about mitragynine, about deuterated mitragynine, about atai's formulation, KOR-101. I think that there is, number one, a lot of money to be made for atai here, and number two, I think that an FDA regulated formulation of kratom or mitragynine on the market will benefit a lot of people. Hopefully, they will still be able to procure the regular the plant versions of kratom that people have been buying for many years now, but having this as another option, I think, is just phenomenal. And once again, I think this is a really interesting angle for atai. This is opiate with a much higher safety profile than traditional opiates. The comparison there is no comparison. Is like normal opiates can lead to an overdose. I don't think there is even one single account of a kratom overdose or a mitragynine overdose in the history of people taking it. So we have that. I think this is very significant for atai, and once again, I am cautiously optimistic in regards to following this study, and I'd love to hear more from atai as things unfold. All right, guys, and up next, we have atai and delivery systems. That's going to be the next two things I speak about. So up first here, we have atai Life Sciences announces initiation of phase 1 proof of concept clinical trial for its Sol Gel-based direct-to-brain drug delivery technology. So what is this exactly? It's essentially a nasal spray with Sol Gel inside of it. Now, the advantages of this Sol Gel are that, number one, ease of administration, increased patient compliance, lower dose requirements, rapid onset of action, and minimized systemic exposure. Now, the reason for the lower dose requirements, the rapid onset of action, and the minimized systemic exposure are because of the fact that you're skipping first pass digestion. You're going straight to the bloodstream by using it in the form of a nasal spray. So I think this is very important when it comes to a lot of different drugs because, number one, lowering the dose requirements is always better for the patient because it minimizes the amount of drug within the person's system, and a lot of these drugs can be taxing on a person's body. So you would want to minimize it. In regards to the rapid onset of action, that's self-explanatory. And the minimized systemic exposure, once again, that's because it's skipping first pass digestion. So it's not circulating through your body, it's going straight to the brain. Now, the advantage of this specifically is for drugs that have to do with cognitive impairment or CNS drugs. atai has one specifically in their pipeline, RL-007. It's for cognitive impairment associated with schizophrenia. Now, just speculate here. Imagine putting RL-007, I want to make sure I get that right, in this Sol Gel and putting it in a nasal spray. Now you have the ability to spray this up your nose, and it targets, once again, your brain, exactly where it needs to be. It doesn't need to go through your stomach. The formulation or the medication isn't getting degraded in the acidic juices in the stomach. It's going right where it needs to be. So I think that's pretty significant in my opinion. And there are applications for this that aren't just for RL-007. We can speculate and say, in general, for Alzheimer's or dementia drugs, they would benefit greatly from this. Now, even further, we could speculate in regards to psychedelic drugs. So any psychedelics, hallucinogenic or non-hallucinogenic psychedelics, you have they're neuroprotective, they're neurogenerative, and they increase neuroplasticity. Now imagine being able to inject these to basically, you have a nasal spray where, you're injecting it right into your nose and right to your brain. I think, number one, that's pretty interesting. And as a psychonaut myself, that was just a really, really interesting delivery method for psychedelics in general. But I digress. this would just be a way of reaping the therapeutic benefits of psychedelics in the brain without having to, number one, have them go through the stomach or first pass, and you can skip first pass digestion. I just think that this shouldn't be slept on or overlooked. And I like Atai's perspective on this in regards to drug delivery systems. So really into this. And once again, another thing in Atai's war chest that I'm cautiously optimistic about. And let's see what happens with Soul Gel. Now, to build on drug delivery systems, we have Atai and their partnership with intelGenX. intelGenX ticker symbol is IGXT. They are a publicly traded company. So basically, intelGenX does oral thin films. So these dissolvable or oral thin films. Now, the advantages of these oral thin films are actually very similar to the nasal spray that we just spoke about. Except that these go in the mouth. So the advantages are faster onset, they skip first pass digestion, they can lower the dosages. It's literally the same exact thing as the nasal spray, except these are oral thin films that you put in your mouth. So once again, I'm really, really just interested, and I commend Atai for focusing on drug delivery systems. So what they're doing with intelGenX, and so once again, this is kind of connected to what I was saying in terms of putting psychedelics in that nasal spray. But what they're doing here is they're putting DMT on one of these oral thin films that skip first pass digestion. Now, to me, that's really, really damn interesting. So now why they would choose DMT as the molecule to put on one of these oral thin dissolvable films that skip first pass digestion. Well, the main reason here is because you don't, so in general, for ingesting dimethyltryptamine, you have to mix it with MAO inhibitors. Now, MAO inhibitors can come with a bunch of different side effects, ranging from nausea to insomnia to diarrhea to constipation. There are just side effects that come with MAO inhibitors. Now, when you take them out of the equation, because you don't need to mix them with DMT in order for the DMT to be effective on one of these oral thin films, I think number one, it can save on cost. And number two, once again, for patient compliance, this is very significant. So now you have an oral formulation of DMT that doesn't need to be mixed with MAO inhibitors. And this, as far as I know, is going to be the only ingestible form of DMT on the market that doesn't need to be mixed with MAO inhibitors. So now you can basically, with any form, I'm going to say this one more time, with any oral form of DMT. So oral DMT mixed with MAO inhibitors is essentially ayahuasca. So it's like the effects are pretty damn similar to ayahuasca. The active ingredients are exactly the same to oversimplify everything. Ayahuasca is a mixture of dimethyltryptamine and MAO inhibitors. The MAO inhibitors you ingest with the dimethyltryptamine allow your body to digest the DMT and actually receive the psychedelic effects of the dimethyltryptamine. So what they're doing with this oral thin film is they're taking MAOIs out of the equation. And now you have a formulation of DMT that you can take. It goes right to the bloodstream, and you get the effects of the DMT without MAO inhibitors. I sound like a broken record already. I apologize. But I just think this is very, very significant for any type of DMT therapy. Because right now, the only other way you're going to be getting the benefits of DMT without MAO inhibitors are two ways. Number one is if they're IVing it. So if you're getting an injection or you're getting it IV'd right into your bloodstream. And the other one is if you're going to do an inhaled version of DMT. Now, in regard to the inhaled version of DMT, there are a lot of patient compliance issues that come along with this. People don't really have not everyone has the lung capacity to hold in a gigantic hit and to take a gigantic hit and then hold it in for as long as possible to get to those breakthrough DMT experiences. It's actually very common when people are not able to, number one, take a hit big enough or to hold it in long enough to yield I guess, to get their lungs saturated with the dimethyltryptamine in order to get to those breakthrough DMT experiences. And I actually know most people who are doing DMT don't even get those breakthrough DMT experiences because of those reasons exactly. So this takes all of that out of the equation. You essentially have DMT on an oral dissolvable thin film that skips first pass digestion. This is extremely significant for psychedelics, in my opinion, especially for dosing people with DMT. And I just think, number one, this is going to be great for DMT in general, in terms of with psilocybin, with LSD, it's very easy to dose people orally. With DMT, we don't have that yet. Or we don't have it in as simple of a way as what these oral thin films will be. I think in terms of patient compliance, this will be head and shoulders above mixing dimethyltryptamine with MAO inhibitors. I can't wait for more information to come out of atai and IGXT's camp in regard to this. But once again, another drug delivery system that I am eagerly following. IGXT is also really interesting because, so I mentioned Alzheimer's before. They're also putting montelukast, which has been, the indications they're looking at. It is an anti-inflammatory. Specifically, they've noticed that it can have an effect on neuroinflammation and help people with mild to moderate Alzheimer's. So. And they're putting this on an oral thin film, and it's running through the trials right now. Emory's doing a study on it as well. So this is something that atai has. They own 25% of IGXT, the small company, who's doing some pretty tremendous work, in my opinion. So definitely worth taking a look at. I really like this pipeline update from atai in general. And I think that atai's war chest in regards to the drug discovery, the drugs, the formulations that they have in their pipeline, and also their perspective in terms of acquiring pieces of these drug delivery companies. It's pretty significant. It's pretty interesting. I don't see any other company within the psychedelic sector doing anything like this. So yeah, I hope you guys enjoyed this video. That is the end of it. My name is Adam Tabero with psychedelicinvest.com. You can reach me on Reddit and Instagram at waxingeloquence, WAXINGELOQUENCE. And I will also leave my email in the description of this video. If you want to reach out to me to come on this show, feel free. If you want to chat about psychedelics, if you want to chat about stocks, I'm always there. I'm happy to interact with the community. Have a great day, everyone.